face a lot of challenges when it comes also to attacks on olive fields by settlers and other Israeli forces. Could you speak also to that and the situation there of women? Thank you.
Yes, thank you very much. On pregnant women, you can imagine the impact of malnutrition on pregnancy, as well as the impact of limited medical access. As you know, there is quite very limited number now of hospitals still functioning. Most of them are partially functioning, and they're looking, I think the last number I was looking was 13 out of 36. So it's difficult to have access. Plus, you are looking at a situation where people are living in overcrowded spaces where infectious diseases are much more rampant. So that does affect also pregnant women. Some of the stories I've been hearing also for pregnant women is that some of them are so fearful of delivering in conditions that they have no control over, that we're hearing that some are actually asking if there's a way for them to deliver more rapidly. So the overall situation is quite horrendous. I could refer you also to one of the gender alerts that we published just a few months ago on the water and sanitation, where we also looked at some of the impact on pregnant women and also on lactating women. On the West Bank, in the last few weeks, I've also been visiting some of the refugee camps in the north of the West Bank. I've been to Tulkarem, to Jenin, to Kalkilia. The situation is also quite challenging for women. I visited notably some of the camps where airstrikes had been used and where you've seen houses completely destroyed inside the camps. The situation is very dire. I spoke with some of the women who were explaining to me the difficulties that they face every day and just trying to make do with the reality. The economic situation is quite difficult. There is also a lot of limits on movement of people that is affecting, obviously, all of the population, including women. I spoke with young women who have not been able, to move outside of the camps to continue with their schooling in some cases, and so on. So you are looking at a very challenging situation. Some of the comments I was hearing from the women in the north was their fear, their constant fear, their fear for themselves, but also for the fear for their children, and also feeling that nowhere is safe at this point. And it is something that we're hearing more and more. Thank you.
Bisan Abu Quaik with Al Jazeera Arabic. Thank you very much for this briefing. Just to follow up on the question of pregnant women, there had been reports about children being either born stillborn or with birth defects. Was this something that you have seen or spoke to women who have through this, if you can elaborate a little bit more. And then on schools in Gaza, how the demolition of schools, children being out of schools, young girls being out of schools in particular, how has that affected young girls in Gaza?
Thank you. On the first part of the question, while I did not have direct on discussions with women on these issues, there were some of chronic diseases. As you know, there's no possibility of coverage of some of the chronic diseases. I do know a story of a young child who was suffering from chronic diseases and unfortunately could not have access to medication and specifically passed away. You have to understand this is extremely dire situation. I did visit Al-Aqsa Hospital while I was there. One of the wards that I visited was for the premature children. So I saw babies who were in incubators. It was quite difficult because when we were there was a power shortage, so the electricity cut. Thankfully, it was restarted. As you know, they're using generators. But it's extremely, extremely difficult situation to see for that affects, obviously, children, but also different groups of age. Also looking at the elderly population, and you also need to factor in people with disabilities. Situation could be already challenging before the war, but now it's even more challenging. People have no devices, have limited support, and so on. So it's a very challenging. We could share more information with after the briefing if this is useful. On school, there's not been school in Gaza since October. Schools have been turned into shelters. I visited one in Deir el-Balah, where you had 14,000 displaced people living, if one can say that. So education, young children have not been having access to education. They would like, one of the things that we hear and that we see, and on helplines actually, young children wanting to have school. And this is something that some of the humanitarian actors in the coming weeks will be trying to establish at least some learning activities and so on. Some have already started. I visited some sites where for a few hours. But as you know, traditionally in the occupied territory, education is extremely important and extremely valued. So this loss of the last year is extremely damaging for everyone. Yeah, thank you.
Thank you. Ephraim?
Thank you, Steph. We've been hearing also and reading a lot of reports about sexual violence against Palestinian women, including, being severely beaten, raped, threatened with rape, and subjected to multiple forms of inhumane and degrading treatment, such as they were denied menstruation pads, food, and medicine. Can you share with us some of the things you heard around this matter, and what's the scope of the problem, really? Thank you.
Okay, I'm trying to. I'm not sure if I'm fully responding, but we have seen an increase of violence, different types of violence in Gaza as this war is ongoing, and we've seen it on women, and we've seen it on children. Do you have a specific, when you're raising this question, do you have a specific background on this that you want me to look at?
We have been reading for the past several months various reports from various human rights organizations, whether Palestinian women who came out of Israeli prisons or whether women who are in Gaza. The story has been ongoing for months now, and I was wondering if you have heard things you could share with us on this matter.
I think my colleagues my human rights colleagues are best equipped to respond to this. I think it would be best coming from them than from me on this one.
Thank you. We're going to go online. Abdelhamid?
Thank you, Madame Maryse. I apologize for not being able to open the camera, but I have a few questions too. You have been working in the occupied territories for some time. Can you tell us more about your experience with Palestinian women before this war of genocide and after? And second, follow up to the question of my colleague Ephraim, if you have met with Palestinian women who were released from jail, and if you were able to talk to them. And lastly, if you can tell us about Women Association in Gaza, are they still functioning or they have been disbanded? Thank you very much. And I apologize again for not being able to open the camera.
Thank you, sir. No problem. Yeah, I've been working for them.
Sorry, I forgot to introduce myself. My name is Abdelhamid Sayam from the Arabic daily Al-Quds Al-Arabi. Thank you.
Thank you. I've been working for a number of years with women's organizations, both across the occupied Palestinian territory. They're very solid. They're very, they have a very large experience at different levels. They work on economic participation, on political participation, on ending violence against women, and so on. So my experience with them is quite long and addresses different types of issues. I did not, while I was in Gaza, I did not meet with released women from detention. This is why I'm not reporting directly and prefer that colleagues from the human rights who have do that. I think it is better. Look, we produced a few weeks ago a gender alert, what we call a gender alert on women-led organizations. And as I said when I was providing the briefing, we looked at 25 of them, 18 of them are based in Gaza. When I was in Gaza, I met with many of them, and they are providing extremely important services, not just to women, but to communities at large. And it is why I keep saying it's so fundamental that we support them in moving forward. Thank you.
Great. Maurice.
Thank you so much.
Maurice, thank you very much for taking the time. We hope to welcome you back here anytime you wish. And I wish you all a good rest of the day. Thank you.
Thank you very much.
Arrived since 10 days, have lung contusion injury and leg fracture. She was on mechanical ventilator. Since 3 days she is extubated, but now she's breathing on room air. I hope to be more better. This is the worst time now because we haven't any bed and we have a crowded in ICU, full bed, an emergency room, full bed, and we have an IDPs in emergency room. The OR also working 24 hours continuously. Sometimes we work like 24 hour and off 24 hour and another. We need more of medical supplies like things like to deal with the bleedings, to deal with burn, to deal with fix like wires and pins. We need a lot of things for abdominal gauze, a lot of things for infection control, a lot of experts also to support us in managing of these cases. All child now facing something like PTSD and need psychological support. So that team here on the staff start to psychological support this young lady, young child, and use some eating therapy, some like toys for this child. She want to get an auto mask for this toy, and I think she hope to be a doctor in the future to treat another victims like others, treat them.
It's a really important day. We're going to try and get truckloads and truckloads of life-saving medical supplies to people in the north of Gaza who are in desperate need. I'm now at the hospital's church. This hospital's where we delivered aid. This church is like an emergency ward, strewn with people with wounds of war, as are outside where there are even more children who are injured. This reality, time and again, as UNICEF has been saying, because nowhere is safe in Gaza, and nowhere will be safe until this humanitarian pause is turned into a lasting ceasefire. UNICEF delivered emergency health kits, kits for midwives. Women are giving birth in this war zone all the time. There is a desperate lack of water and a desperate lack now of sanitation and things like multivitamins for children because we're so worried about the nutritional status. These are critical life-saving supplies that we could deliver. Of course, for that, this humanitarian pause must turn into a ceasefire. We cannot, in all good conscience, possibly go from a few days of respite for people to returning to the bombardment of Gaza and the killing of so many children.
How to make money is definitely are the young people pioneering the global climate innovation industry.
We are ready to go for the extra mile, and we don't care if we get dirty, if we get tired.
We are the ones that are bringing tomorrow by what we are doing now.
Investing in an industry of young climate innovators means a resilient economy for us all.